Okay, so the history is role is you are the specialist trainee in a district general hospital, setting outpatient clinic. You are talking to Jay's mother of Samuel. So the referral letter from the general practitioner is, Dear Doctor, referring Samuel Adams, thank you for seeing this 14-month-old boy with persistent cough and wheeze, unresponsive to salbutamol. He has mild respiratory distress on occasion, but has never required hospital admission. He was born at 27 weeks gestation and had a difficulty first 2 weeks of life. He was ventilated for respiratory distress syndrome and had chronic lung disease. At first, I thought he had bronchiolitis, but this has persisted for a while and his mother is anxious. He has a developmental follow-up clinic at City Hospital in 4 months, but I would be grateful if you could see him before this. His mother has attended my surgery 4 times in the last 2 months. Yours sincerely, Dr. Jeffrey, general practitioner. So, 14 months having a problem with the cough, wheeze, which is not responding, and he's a premature 27 weeker.
Okay.
So, are you ready, Dr. Rifat and Dr. Helen?
Yes, I am ready.
Yes, I'm ready to.
Okay. Dr. Rohit, will you set the time, please?
Okay.
Okay, so you will remind 9, 13, 19, and at the end. So, Dr. Rifat, will you be the examiner? Is it okay for you? After this role player.
Samuel is the child name and mother name is Jessie. Jessie, right? Jessie.
Whatever.
Okay. Okay. So,
yes, I would be examiner too if there would be everything right on my side. And if there is disturbance, then you can take over at that time.
okay.
Okay,
So
so I hope everything will be right.
let's start. Dr. Ifaz, ready? Hello, good morning.
Good morning.
Start. Okay.
I am Dr. Hiren, one of the children doctor here. I believe you are mother of Samuel, Miss Jessie.
Yes, I am mother of Samuel.
Miss Jessie, today I am here to ask you some question about Samuel concern. Is that okay to talk to you during right now?
Yes, it's okay.
Okay. Miss Jessie, is that okay if I write few notes when I ask you some question?
Yes, that would be perfect.
Okay, thanks. So, Miss Jessie, could you please tell me what brings you in today?
Actually, Samuel is having cough and breathing difficulty, and it is for so many days. I have tried inhalers as well, but he is not responding. And this problem is being persisting, and I'm afraid that he would have this problem lifelong, and it could damage his lungs. As you already know that he is has a stay in the NICU during the early days. So I am just getting worried that what is going on with him. He is having again and again all the symptoms, and for a week in between he was better, but again runny nose, cough, and some noisy breathing. That's bothering me.
Yeah, I see. I'm really sorry to hear about this. I can understand that you must be quite worried about Samuel health concern. So I will try to help you here. Could you tell me exactly uh, since when he started to have a cough?
First he had runny nose, and
Mm-hmm.
then he had a cough,
Mm-hmm.
and it was 2 months, around 2 months back. Then we got to the doctor. He prescribed some inhalers, and I was giving him regularly, but there was no response. And the doctor said that it might be viral infection. So with time, he got better, but then again, he is having the same problems.
Was that a dry cough, or he was
He,
having cough with
no,
a?
there is some noisy sound I can hear, I can feel from his chest.
Okay.
So he, yes.
What makes his cough worse?
Uh, there is not particular anything that I got noticed.
And anything which makes his cough better?
I tried inhalers, but I think this episode remains for 2 to 3 weeks, and then it goes better. Whether this is the effect of medications, I don't know what is this.
Okay. And was there any fever?
No fever. No fever.
Any difficulty in breathing?
In the first episode, he has some breathing difficulty, but for the later episodes, no, not such. But he had the musical sound that came from the chest, and it seems that he's struggling. But when I go to the doctor, they said no, there is no such.
And
Uh,
was he all right 2 months ago? This problem started since 2 months.
yes, yes.
Was
He
he
was
completely
well.
fine?
He was well, although his growth is not good, and he is going on slowly, gaining weight slowly. But there is no such problem of his chest.
Okay, I see. And during this problems which started since 2 months, were there any tests done? Any investigation?
Uh, no, no, not really.
And you said you were giving the inhaler. Could you tell me in more detail about the kind of medicine which you gave during this 2 months?
Yes, I gave him blue inhaler twice a day,
Hmm.
and sometimes 3 times a day. That's all.
I see. Okay. And uh, apart from your GP, are there who are the other doctors with whom are you taking consultation for
His
Samuel?
pediatrician, yes, his pediatrician and the nutritionist and the brain doctor, they are following.
I see. Okay. So, may I know why you are taking consultation with the brain doctor and a nutrition dietitian?
Because his weight is not up to the mark, so he is having, although he is eating but not gaining weight properly, like my other my other children. His child, he is not well built, and you know that he born very early and he was very small, so
I
that's
see.
why they are just following him. And the brain doctor, because I had a consultation, because I am concerned that he is now 14 months, but he is able just to stand, he's not walking. So I had a consultation with him.
I see. I see. I'm very sorry to hear about his walking problem and about his stormy course when he was small. Uh, this cough and cold, was it happening very frequently or it just happened 2 months ago only?
No, just 2 months ago. Previously,
And,
there was no such problem.
okay, okay. Was he admitted for the same problem before in the hospital?
No, not really. There was no admission.
Okay, okay. And uh, can you tell me about his birth in little bit more detail? Was it birth early delivery or he born on time?
Yes, he born very early at 27 weeks, and he was on breathing machine so for 2 weeks, and he required high potency medication. After that, he was kept on the oxygen that was remained there for a couple of months, and then he it gradually weaned off.
I see. Okay. And any particular other problem happened during this course apart from difficulty in breathing and lung issue? Any infection,
Not really.
any feeding problem?
No,
Okay.
no, he was fine. He was very
Any,
he was a fighter, and he did well.
and what was the
So
birth weight? What was the birth weight?
birth weight was 1.8 kg.
Okay. And what was the reason for preterm birth?
Actually, I had bleeding. I had a trauma, and then after that, there was
I
a
see.
profuse bleeding, and my doctor said that we can't stop these labor pains, and so
Okay.
they
I
have
see.
to deliver the baby.
I see. Okay. Okay. I'm very sorry to hear about this. Okay. So, Miss Jessie, does he have any feats, any difficulty in vision?
No, for the vision, they already checked him. It is fine. He can see.
Okay. Any problem with his heart?
No,
9 minutes.
Okay.
9 minutes.
Okay. Any problem with his poo and pee?
not really.
Okay. Any skin rash?
No,
Okay. Okay. And how many children do you have?
I have one other kid. He's 4 years.
Okay. Is he all right?
Yes, he's fine.
Okay. And so for feeding, you are following the dietitian plan for Samuel. Am I right?
Yes,
Okay. How is his growth, his weight? Any problem with his weight gain and development?
he is gaining weight, but slowly.
I see. Okay. How you are coping with this situation, with his condition?
Actually, it is very difficult, but it is still manageable because I'm at home and I send my elder kid to the nursery. Before going to the nursery, it was very difficult, but now I can manage the time, and that's why I can take care of him.
I see. Okay. Okay. And how the Samuel is coping with this condition?
He's very nice kid, and uh, I just take care of good. I just take good care of him, and the things are going on. But recently, for the last 2 months, he is disturbed, and that's why we are getting worried. Sometimes the cough is more increasing, and sometimes with time it gets settled. So we are just worried for this
Yeah.
problem.
Yeah. Do you have any financial support to cope up with
No,
expenses?
no, it's fine. We can manage all the fun.
Okay. And currently, you said Samuel is on the blue inhaler. Is there any other medicine which you are giving to Samuel?
No, there is no other medication.
Okay. And is he on any oxygen support or uh, any long-term medicine was which he
No, initially in the first few months of life, he required oxygen, but then it get off.
so now he's 14 month and
Yes,
still you said he's having difficulty in walking, but what about seating and
yes, he can sit. Even he can stand as well. But still walking, my elder kid, he was able to walk at this stage, but he
okay,
is not doing.
okay, is he has he received all the vaccination, all the jabs on time?
Yes, he got them. Yes.
Is he having any allergy
Not really.
to any medicine or any food?
No, no.
Okay. And what about you? The medicine and the care. Are you the one who is providing care to Samuel, or is there anyone else who take care of Samuel at home?
No, I am taking care of him and I am giving medication.
Okay. Uh, you and your partner are the first degree relatives. Are the uh, from the same family?
No, we are not related.
13 minutes.
Yeah,
13 minutes.
both of you are working.
Khalas.
Okay.
No, I'm not
13
working.
minutes.
Okay. Okay. Fine. So let
Okay.
Please summarize your case, doctor.
Yes.
yeah. So I took a history today of a 14-month-old Samuel who was born preterm uh, due to some maternal heavy bleeding, and he was admitted in the neonatal ICU. He was having a respiratory distress, and he was also uh, kept on the ventilator for probably RDS. He has presented since 2 months with the on and off cough and cold, and currently he's on a blue inhaler, salbutamol inhaler, but that cough is not responding, and still he has some noisy breathing. Apart from that, he has some difficulty in walking, and it is a little bit difficult for mother to take care of Samuel as well as the other son who is 4 year old other brother, and there is no any history of allergy. The Samuel is also in consultation with the neurologist as well as dietitian. So far there is no issue with the any heart or
So,
problems or any allergic issue.
okay. So, what do you think? What is the problem or the diagnosis?
Yeah. So I would like to consider here 3 or 4 problems. Probably the on the top of that, in the top of the differential, I would like to consider chronic lung disease with probably bronchiolitis. Uh, Second thing is reactive airway disease beginning,
Okay.
and very less likely
So,
body.
so do you think bronchiolitis is going on for the 2 months?
Uh, it can be like initially he got probably bronchiolitis and then the residual cough. It could be.
Okay. Okay. So, for the chronic lung disease, is he still having the same problem? Because he's not more on the oxygen.
Yeah, currently he is not on the oxygen, but with the
No
background,
medication.
yeah, currently he is not on the oxygen support and not any diuretic or any chronic lung disease medicine. But considering the background history, this is one of the differential.
Okay. And when would you investigate a child who is having the persistent wheezing?
When was child? Sorry.
When would you investigate a persistent wheezer?
Yeah, the uh, when the wheeze is persistent more than like 4 week, then need to move 4 to 6 week. Then we need to consider the different possibilities like residual wheezing, post bronchiolitis, uh, also the foreign body, Also the possibility of the beginning of reactive airway disease.
So did you ask about the foreign body
Uh,
in this child?
Body here I did not ask because it was not like acute onset. There was a history about the, he got the cough, and he started with the common cold and then he started with the cough.
Okay. So did you ask about the any trigger, like does he have pet or anyone smoke?
No, I didn't ask for the smoke. Yeah, smoke I didn't ask.
Okay. And did you ask about the exposure to any COVID-19 patient?
Exposure to COVID-19, no.
Okay. So would you consider COVID-19 infection in this child?
Yeah, I think considering the current situation, we need to ask whether there is any exposure with any contact or was there any fever. But in this child, there was no fever.
Yeah.
And the child
Okay.
was seen by the reviewed by the GP, and in the referral letter, it was not raised the also the
Okay.
concern.
So what is the corrected gestational age?
Corrected gestational age, he's a 14-month-old, so we need to calculate. He was born at 27 week, right?
Yes.
Yeah. So if it is a 27 week means 2.5 months I will deduct from 40
Okay.
to
Okay.
approximately
Okay. Okay.
11.5
So
to 12.
how would you manage this child?
Yeah, so this child, I would like to do first the full physical examination, and
Mm-hmm.
after that, I would like to plot his centiles into his measures into the centile chart, uh, and
Okay.
and then would like to consider a couple of investigation like the basic blood test, CBC, and inflammatory markers like CRP, as well as the X-ray test to see the lung hyperinflation or any infiltration is there or not. Also, would like to check
So
the
why are you considering the CRP uh, and chest X-ray?
chest X-ray to see is there any infiltration, is there any pneumonia, is there any milk aspiration.
Did you ask about any feeding difficulty or the child does throw any feed if you are suspecting GERD or like this thing?
I asked about the feeding, but you, I think, replied like he's on the under the guidance of the dietitian and nutritionist.
Okay.
But I did not ask for the vomiting, especially.
Okay. Okay. So particularly in this child, what would you investigate? Do you investigate or not? Particularly in this child having the cough, and what parameters you will look for, and then you do the investigation.
Yeah, I should consider two or three possibilities like RSV nasal swab for the respiratory syncytial RSV screening, as well as for pertussoid also we need to do
Did
screening.
you ask about the pertussis clues like cough in the bouts associated with flushing of face or breath holding or any throwing after bouts of cough, or is there any abnormal noise at the end of cough bout?
Yeah, I ask about in detail about the cough, what is increasing factor, relieving factor, the nature of cough. And in that, you
Mhm.
mentioned like a cough, there was some wet cough, you felt some noisy sound.
Mhm.
You didn't mention like anything which is worsening or relieving. So,
Okay, so I think this
9,
child is too young to say that it is wet or dry.
9 minutes complete.
Okay. Okay.
You can continue.
I think the feedback and then we can continue.
Okay.
Okay, so Dr. Hiran, it was a good attempt. You introduced really nice and greeting was very good. Then you asked mother first, I think open-ended question. And after this, you asked the close-ended question. That is nice. You did the systematic review, but there was something deficiencies. Like if we do the systematic review from the head to the toe, then it would be more easy not to miss the things like brain and then hearing, vision, and jaundice or
I
uh,
I asked you
you did,
about
yes,
vision,
yes,
about fits.
you did the systematic review, but I'm saying that if we do from in the systematic way, because there are so many things, if we go from the head and then go down, then there is less possibility to miss anything. You did the systematic review,
Yeah.
and in the other components, surgery was. I think you didn't ask about the any history of surgery.
Yeah, I didn't ask
Uh,
surgery.
so about the developmental history, I was about to ask that whether the child is growing normal developmentally. So here the corrected gestational age is 11 months around, and he is able to stand, so it is fine according to the corrected gestational age. So there is no developmental issue. And regarding the other components, you did nutrition, allergy. About the social, the pet exposure to the any pet or smoking, that was nothing. Otherwise, empathy was there. And in this young child, we can't say that the child is having dry cough or wet cough uh, because they are. It is difficult. And the about the labs, you make the differentials: bronchiolitis, chronic lung disease of infancy. So we can say that on the background of chronic lung disease of infancy, it could be recurrent episodic viral wheeze. This is the terminology, episodic viral wheeze, or it could be other things like you said, bronchiolitis or the reactive airway disease. It could be like this thing. And immunodeficiency was another differential in the history. We can ask there is any other infection like gut infection, diarrhea, or other things. Um,
That
you asked in the
yeah, there is like any issue with these poo and pee, means diarrhea, constipation. If there is any other things, you should mention. You should reply to that, right?
okay, or there might be some skin infection, abscess, like this thing.
Mm-hmm.
Uh, Otherwise, the components were okay. About the COVID-19 exposure, we should ask, and this child should not be investigated right this point in time. About the labs for the persistent visa, when we should do that is if there are focal signs are present. Focal signs that will indicate either there is foreign body or there is some obstruction or there is crackles. If there are the crackles are there along with the underlying fever, then pneumonia can be considered. Or if there is faltering growth or the patient has the loose stools, considering the cystic fibrosis in mind. So at that point in time, we can investigate uh, a child with the persistent wheezing. Uh, I think that's all. Hmm.
From my side, Dr. Hiran, you have done a very nice job. It was very, tone was very nice.
Thank
Like
you.
sympathy was there, empathy was there. Few things which I want to say, but take it as a positive way.
Mm-hmm.
You didn't ask about the differential diagnose. So whenever we are taking history, we should make a list of differentials which should I rule out. like doctor said about this viral wheeze, episodic viral wheeze, or recurrent infections due to immune deficiency or cystic fibrosis. For that, you can ask a question like recurrent ear discharge or recurrent infections, fever, nasal discharge, some kind of these things. Or as you should ask about asthma also. So
Any family history of
daytime,
asthma, eczema, atopy?
yeah, cow milk protein allergy. That you can ask about the
He
breastfeeding
asked
or
about the allergy to any food. He asked about allergy to any
yeah.
food
He
and
asked at
drugs.
the end. I remember. Yeah, he asked at the end, and about this aspiration pneumonias because he's following for brain doctor also. So
Mhm.
gastroesophageal reflux, I mean to say, bronchiolitis, pertussis. For the pertussis, any noisy breathing from the windpipe or some kind of choking, and foreign body, though very less likely, but
But the older sibling is there, so there is a
yeah.
possibility that
So you
he can
should
have
ask
the
about
same.
when this started. This cough, he was around anyone siblings around him or her. So this is rash or skin allergy. So these should be addressed. One thing, another thing which I feel little bit deficient was there about completely explore about the natal perinatal history because he was only 27 weeker. So
Mhm.
you should ask about any this cardiac lesion or
I asked about
brain issues.
any
Yes,
heart.
he asked. He asked. Yes, he asked. He asked about the heart issue. And he asked about the vision as well.
Yeah, vision he asked, hearing he asked,
Uh,
but maybe
he
I
asked
didn't.
about the heart as well. Heart as well.
Heart also I
Yeah, I
asked.
didn't.
Yes. Any tummy
Uh,
issue, he asked about that.
Okay. Otherwise, that was nice, and should ask about the hospitalization how many times because this is, if you are thinking chronic lung disease, maybe he
No,
has
he
more
asked for the.
Yeah,
hospitalized.
he asked. I
He
think
asked.
he
He asked
asked
for.
about that. Yes,
He
he
asked
asked
for
about
this.
that.
Yeah,
so
others okay.
I just want to just say one thing. When you take the history, I mean, thanks. Actually, many of the points
No,
you.
wait, Dr. Hiren, wait, still there are a lot of
Yeah, yeah,
comments. So wait,
yeah, yeah.
at the end
Please,
you will talk.
please, most welcome. Actually, I welcome this
Yes,
comment.
Dr. Irfan.
Yeah,
Yes, Dr. Heron, really, it was nice way how you took the history.
thanks, thanks.
Very smooth way. Yeah, really. I hope I could do like that. And as Dr. Hill mentioned,
You are
the
doing better
differential
than me.
diagnosis.
You are doing better than me.
Me?
You are
No,
taking history in a better way than me.
no, your style was very good, very, quite impressive. And when you are
Thank you.
talking about cough and shortness of breath and this thing, you can ask for the cough how it was. You didn't dig about the cough much, like for the pertussis point of view, you can ask
Mhm. Mhm.
something like choke, foreign body point of view, any associated with the feeding during that time. So this give the impression you are having the differential in the mind. And other thing you ask for allergy, and this mother told that his one son, is uh, one of his sibling going nursery. What is the information you will get from this point?
This may be the child going to nursery could be bringing the viral infection to the home, probably.
Yeah, this can be one of the possibility. He
Yeah.
may get the infection from nursery because newly joined. So this is one of the possible source of infection. So this
Yeah,
is
yeah.
this can be the possibility because and the management point of view, why we will admit this patient.
No, no need admission, but we need to work up X-ray, saturation,
Okay.
plotting weight and centile. If saturation there is a problem, if there is a distress, then also might need admission. But if oxygen saturation is okay, there is no distress, then no need for the admission. So all these things, I mean, it goes with the flow, how the information is coming back. Like here,
Yeah.
you ask me, the child possibility. So here, I will ask only one or two questions. Whether there is any sibling, she said yes. Is he fine? Is he okay? Any problem with him? Said no.
Yeah.
Okay. Then I will close this. I will not dig about his brother more.
Very nice. But you need to dig for the social history.
No,
Like,
I mentioned that initially it was difficult to manage, but for recently we go to the nursery,
yeah,
so
yes,
now
you
it is
told.
manageable.
Yeah, that's a
Yes, I
Yeah.
social component. Yeah.
Yeah.
yes, but
That's
the
why I'm
flu was
coming.
here.
Yeah, there's a clue. This is a clue. That's why I mentioned that he's bringing infection from the nursery.
Yeah, if you ask me on the differential, I would say like this is calls also one of the possibility. He
Yeah,
might.
and secondly, when you are in the social history,
Hmm.
you didn't dig much for the social history because I think you left with no time. That's why I think you didn't go for that. So social history also in the view, smoking, pets,
Yeah,
and
smoking
living,
and fat,
how they
I
are living,
yes,
and
yes,
how about their jobs, both are working or not, who is taking care. You ask for this, who is taking care of this child,
yeah. I
and
ask
how about the
who
other?
is taking
Yeah,
care,
you ask. Yeah,
financial, how
you
both
ask it.
of them they are coping, about the
Yes,
partner.
yes. But
Yeah.
if you have no time now, just this is a
But
best way. You
smoking,
just cover the in our respiratory system. We need to ask smoking
yes,
definitely,
smoking I
and
forgot, yes.
yeah,
Parent,
this is the yeah any respiratory problem or condition we have to ask for smoking.
yes, correct.
Yeah. Then if there's smoking, then you need to ask some question more as according to the situation. You know it. So these are the things which anybody can miss, but this is a very art of history taking is a very big art.
Yeah,
So with the passage of time, inshallah, everybody will get better. Anyway, it was good attempt. Keep it up, inshallah.
thanks. Okay, anybody, any further suggestion?
And X-ray, you asked for it. Why would do X-ray?
X-ray will keep two, three possibilities. One is like, let's say, pneumonia or any bacterial infection. Secondaries,
But no fever. But no fever.
But you didn't keep it in the differential. You didn't keep it in the differentials, and
look.
I was saying that particularly in this child, what you would investigate or not.
Yes,
No,
like this.
differential, you see, how you will put your question in front, whether there is any fever, any difficulty in breathing, right?
No,
No, no,
boss.
you
No,
got
no,
the
no, no.
information. You got the information
Doctor,
that there is no
Doctor
fever.
Hiram.
Mhm.
No, you didn't ask. Your baby is condition is better than before, same like before, or worsening.
I ask, no,
Was the
anything
point?
which is worsening this cough, anything which makes better, you will find this in the
Yeah,
recording. So
she
Yes,
told.
yes.
you will
No,
find.
no,
Yeah, she
please,
told that.
Dr. Hiran, don't take it personally. We are just saying that
Uh-huh.
you asked about all these things, that whether the cough is increasing or decreasing.
Yeah,
But
yes.
at the end, yes, you asked it. But at the end, you said that I will do chest X-ray. So in the history, you asked the mother about fever, about the any red flag sign like that is pointing towards the pneumonia or inhaled foreign body, like you asked, you have ruled out in the history.
Yes.
So,
So X-ray, if
So
you
so,
that is my.
so we should
That
not
was
ask.
you. No, that is my question. When you ask all these things, fever not there, no worsening of sign of respiratory distress. So foreign body also excluded and aspiration excluded, pneumonia excluded. So what is the rationale going for X-ray?
yeah, rational is for he was having previously, he was a premature delivery. He was needing oxygen
Yes.
for a couple of months. So